Thank you. So the challenges facing low and middle income countries are the increasing chronic diseases, aging, and we are still having to cope with the HIV infection. HIV and AIDS is no longer a routinely fatal illness as it was, but it's now a treatable chronic disease. There has been massive investment that has enabled millions of people in sub-Saharan Africa to gain access to antiretroviral therapy. Younger adults aging with HIV and the primary infection in older adults contribute to the increasing prevalence of the disease in this age group. Although older adults are also at risk of HIV infection, they have not been prioritized in HIV prevention and the testing efforts. In high-income countries, we know that life expectancy for people living with HIV is nearing the general population. Now, looking at South Africa, there are about 7 million people living with HIV, and the life expectancy in this country has increased from 49 years to 64 years since 2003. And the antiretroviral therapy was introduced in 2004. So the increase in life expectancy is mostly due to introduction of antiretroviral therapy. And these increases in life expectancy have been also reported from other countries in the sub-Saharan region. However, despite this, only a minority of studies on aging and HIV emanate from these countries, yet they have the highest burden of HIV. The majority of population-based surveys in sub-Saharan Africa have not included older persons. Just to give an example of this recent publication in Nature in 2019, the map here says change in HIV prevalence in adults aged 15 to 49 between those years. And once you are 50, you disappear. Surveys in the region that have included older adults over the age of 50 have shown a prevalence ranging from 5 to 13%. In 2019, 18.5% of the 24 million people over the age of 15 that are living with HIV in sub-Saharan Africa were over the age of 50. And the modeling in the region predicts that by 2040, there will be about 9.1 million people living with HIV, and this will constitute 27% of the affected population. There are a number of comorbid conditions that occur in the general population, but more so in people with HIV, living with HIV. What is interesting that they do also develop geriatric syndromes at quite an early age, and for example, bone fractures, osteopenia, frailty, and decreased physical function, also onset of neurocognitive dysfunction. And the HIV has been seen to both accelerate and accentuate this aging process. The reasons for this accelerated development of non-communicable diseases is not fully understood. It is thought that direct HIV infection in the end organ and the co-infections, they do activate immunological pathways, even though the infection is suppressed by ART treatment. HIV also promotes increased cellular senescence by proliferation of pro-inflammatory T cells. And there are also metabolic effects of the drugs that do predispose to development of non-communicable diseases. And we know of the traditional risk factors. This study is from Brazil, another low middle income country. It shows that people living with the HIV by the 50s, they are about 60% have got 2 or more chronic diseases compared to the people who are not infected. They only 25% showed to have 2 or more chronic diseases. So the co-infection with the acute and chronic diseases that are prevalent in the sub-region, for example, TB, malaria, more hepatitis B, C, and intestinal infestations, the difference prevalence in substance use and other risk factors, and the lack of healthcare access for management of these chronic diseases. Also, HIV stigma does delay diagnosis and initiation of ARTs in these populations. Also, especially among the older population, low health literacy may affect self-management in people with the chronic conditions. Therefore, for these reasons, research findings from high-income countries may not necessarily apply to low settings as in the low middle-income countries. So really, as has been said throughout the conference, more research is needed on HIV in older people, especially in low-income countries. What is needed is cohort studies that include sufficient number of older people living with HIV in these settings to examine the interaction of HIV and aging over the life course. Surveillance and the surveys should include sufficient number of older people living with HIV. Only then can we have accurate estimates of prevalence and incidence. Aging in sub-Saharan Africa with the HIV and AIDS has the implications for policy, planning, and practice. Although we have been saying we need our own tools, we can collaborate with our colleagues in the North, except we have to choose what will work in our region and what we can adapt. Thank you.
Thank you very much, Sebastiana. Lots of interesting things there. I do have one thing that perhaps you can address is the relative prevalence of more severe cognitive impairment in people living with HIV who are over 50 years old. So we know that since the advent of combined ARTs, that we tend to see more of the mild or moderate kinds of cognitive impairment that they become more prevalent than HIV dementia. But can you tell us anything about prevalence of HIV dementia, how that might change as people age? Do the numbers get different in terms of severe cognitive impairment in people living with HIV over 50?
Yeah, with the aging, there is sort of risk of developing dementia, and this is more so with the combination of the level of education, as we know. So the infection with the HIV will also lead to cognitive impairment, because as I mentioned that the infection of end organs, even if there is suppression with the antiretroviral therapy, there is a grumbling, ongoing inflammatory process, which obviously will also affect the neural system, and this effect will be more pronounced than a person who is aging without any other super added factors that promote inflammation. as we know that inflammation is one of the causes that lead to neurocognitive impairment.
Yes, yes, absolutely. Okay, thank you, Sebastiana. That is your time. Thank you very much for a fascinating presentation.